Thank you very much, Dr. Yang. Uh, may I uh, may I apologize that I have something to announce in Thai, and then Dr. Perth will announce in English before Q&A session. I would like to make an announcement for the audience. สำหรับท่านที่เข้า Account Zoom เดิมไม่ได้นะคะตอนนี้เราได้เปิดอีก1 Account นะคะรายละเอียดอยู่บนจอแล้วนะคะแล้วก็ท่านสามารถเข้าไปดูรายละเอียดได้ที่Facebook นะคะ Facebook ในเพจในหน้าของคณะสังคมสงเคราะห์ศาสตร์ได้ค่ะนะคะจะมีรายละเอียดนะคะท่านสามารถเข้าชมได้จากอีก1 Account ของ Zoom นะคะตอนนี้อาจารย์เพชรจะประกาศให้กับผู้ชมที่เป็นชาวต่างชาติค่ะ
So yes, just a quick announcement that we've set up a new Zoom account that will be that's on the faculty Facebook. So please do join using the new Zoom link, and it will also be shown on the screen in a few seconds, I think. So please do use that link, please. I'd like to thank you very much, Professor Pei Shan Yang, for your comprehensive and informative presentation. We really appreciate your time and for taking us through your presentation. Thank you very much.
ในช่วงนี้นะคะก็จะเป็นการถามตอบนะคะท่านใดมีคำถามสำหรับดร.หยางนะคะจะเป็นคำถามหรือคอมเมนต์นะคะแสดงแลกเปลี่ยนความคิดเห็นได้ค่ะจะถามเป็นภาษาอังกฤษหรือภาษาไทยก็ได้นะคะท่านที่รู้สึกสะดวกใจที่จะถามเป็นภาษาไทยก็ได้เลยค่ะโดยที่ผู้ดำเนินการอภิปรายผู้ดำเนินรายการจะแปลให้นะคะก็สามารถถามสดได้เลยนะคะดร.หยางอยู่กับเราแล้วค่ะ
So I would now like to invite any questions or comments from any of our participants on what we have just heard from Professor Yang.
มีคำถามไหมคะ
Does anybody have any questions?
Got one question from the audience in the room. มีคำถามจากท่านที่ผู้เข้าร่วมประชุมในที่นี้ค่ะเชิญค่ะ
I'm Sorasit Swangsin, faculty member of the Faculty of Social Administration, Thammasat University. Thank you very much for the insightful presentation. You show us a serious challenges to Taiwanese individual and community are facing and effective policy from local and central government. We can also see the community helping in monitoring and Skynet surveillance system. That makes me want to know more on community engagement in government policy formation and practices. Could you please elaborate more on this issue?
Thank you for your question. I'm also personally curious about our Skynet system. From this COVID-19, that's the first time we understand that the government has been using such a digital way of getting information from the public. Okay, and I think there will be more development in that technique and how the society has reacted to such a surveillance system. But for COVID-19 prevention and control, I think that's a must. The Taiwanese people have kind of agreed on using that system for COVID-19. But after that, I think there will be more challenges for the civil society. And also we have other ways for the public for the common people to be engaged in our government endeavors during this COVID fight. For example, at the very beginning, the government has opened up mailboxes of officials which people may leave messages or questions and expect to get answers soon. Okay, and they really made a point to that. And other information exchange websites such as a mask website where we can check how to buy and where to buy masks. And there's also an ongoing opinion platform run by National Development Committee called the Public Policy Online Participation Platform. The Public Policy Online Participation Platform. Normally, common people use local government's public networks, such as Line, or we have a special hotline in each county. People just dial 1999, then they can speak to people in local counties and get their questions delivered to the local government. And for our central government, I believe they still rely more on expert input. So there is a difference between the central and the local government, how people can engage in policy formation and policy practices. Okay, I hope I have answered your question.
Thank you very much, Dr. Yang, for answering the first question from our faculty member. And actually, I got another question from the audience. He is also a faculty member, but unfortunately, he couldn't access the account. So he posed a question for me, so I will read for him. His name is Ajahn Alex. His name is Alex. So this is Alex's question. I would be interested in hearing more about the ways in which the Taiwanese government has been able to maintain a high degree of social trust. Yeah, that's his question.
Okay, thank you for the question. I have mentioned in my presentation, I believe transparency is the key. So for example, at the very early on, the government has decided to have a press conference daily. And now every day at 2 o'clock in the afternoon Taiwan time, people will kind of have been waiting for this press conference. And even as I mentioned, if we have some alarming information coming out, or we have new cases that people need to be alerted to, then our Minister of Health, Dr. Chen Shizhong, will be hosting the press conference on that day. So when people kind of see Minister Dr. Chen that day, and then people will be kind of prepared that something major is happening today. Okay, I think that's a symbol of our social trust. And also we have the community level social trust. In that, our people in Taiwan, we kind of agreed to comply with the government control, and we monitor each other's lives and health behaviors. For example, if people do not wear masks or they do not keep social distance, then very quickly we will see people approaching them, or we will people reacting online to kind of alert people around them to change their behaviors. And also the government has issued an act, especially for this time. I think the act is called the Infectious Disease Control Act. And they are not hesitant to issue a fine or other punishment if people violate the act. For example, if you should be at home being monitored, but if you go out, then you will be fined seriously. Okay, so many little things like that gradually increase our level of mutual trust and the social trust.
Thank you very much, Dr. Pei-Shan, for your answer for our second question there. We are receiving many questions actually from our participants, which is great. Thank you everyone for providing these questions. So over to my colleague to ask a few more questions for you, if you don't mind.
ก็ได้รับคำถามนะคะจากหลายท่านด้วยกันนะคะท่านงั้นเดี๋ยวจะขออนุญาตแปลให้กับวิทยากรนะคะ Dr. Yang, you hear me right? There are so many questions from the audience for you. It means they are interested in your lecture and your presentation. The first question comes from Mr. Chinchai Chicharan. He is also from the Social Work Foundation of Thailand. The first question is about the government measures to support the NGO in Taiwan. And second question is, you mentioned about the long-term care and the laws to support long-term care. He would like to know about the needs. Why do you need for the law for long-term care? Maybe that's two questions first, and then we go to another person. Please, Dr. Yang.
Zoom 的会议是吗？啊，这是什么？哦，我说在那个让他们看。现在还打讯息。
Sorry, I think maybe you didn't hear the questions, Dr. Pei-Shan. So
government measures to support NGOs.
Yes, that's right.
I think in that question, the government is, we have been using a regular information system to have to keep the communication line quite open between the government and the NGOs. So it's kind of a layered information and communication system from the central government to local government, and we have central government linking with the national NGO associations, and then the national NGO associations will have their partnership organizations. And also we have another system from the central government to local governments, and the local governments also have their own system connecting with the NGOs. Okay, so I hope to explain to you well that we do have a different level of information and communication channels working on a regular basis. Okay, and also I think in terms of COVID-19, information is the key. That as long as we have a transparent information, then we will work upon ourselves to do the right thing. For example, in responding to the recent increase of new cases in Taiwan, for example, I work in long-term care field, then we immediately got the information from the news that there are new cases. Then without waiting for our CDC to pass on orders to us, we will be in action to alert ourselves, and we share information like since yesterday I have shared information with my own networks to alert long-term care institutions to, number one, try to avoid sending their residents to any hospitals right now, if not for major reasons. And number two, they try to be very strict in not letting different units of care, no matter it's for healthcare professionals or for patients and residents, we try to be very restricted in not allowing different personnel or patients in different units to mingle. Okay, so that's number two. And number three, where very tight masks and keep social distance in every event. And also we try to alert our family members that this is another, like a big surge of new cases. So try to contain their visits if possible. Okay, we try to be very safe before Chinese New Year, and hope all of you be very safe and healthy for the holidays as well.
Thank you very much, Dr. Pei Shang. We have a couple more questions and a few more minutes left. So if you don't mind, I've just sent you through two more. The first one, why do they need to have a law for long-term care in Taiwan? And secondly, aside from the mental and social support, do the social workers work on labor support? So these questions are from a faculty member, I believe, right?
For regulate. We need to have a law for regulating the services and the institutions, so to have a fair game. For the question, why do we need a law for long-term care in Taiwan? For many years before the law, common people and the professionals, we have had like numerous discussions and seminars, conferences to talk about the law. And there was a major consensus that we do need a long-term care act to regulate all the definitions and service standards for long-term care. Before we open up the long-term care market and welcome all the service providers in. Okay, so everybody now is practicing under the law. We believe that's a fair game. Okay, then in Chinese, it's like we said the bad words first, and then if anything wrong happens, then we would have a law to practice upon, and then everybody, it's better for the control of long-term care standards. And also the law will try to minimize the gap, which I have mentioned. For example, to minimize the gap between the rich and the poor and the rural and the urban areas. The law enables the governments, both the central and the local governments, to put in more resources and money in the remote areas, things like that. So that's why we believe that we need to have a law before we started opening up the long-term care markets.
Thank you very much, Dr. Yang. Yeah, you have one more question.
More question. Oh, now I can hear you suddenly. Okay. Aside from mental and the social support, do the social workers work on labor support? Yes, we do. Social workers do work on labor support. Actually, for example, one of our PhD graduate, Dr. Ye, she is the division head of the Taipei City government labor department. Okay, so we do the labor and employment issues are a major social work area in Taiwan, and we do try to train our students focusing on that area. So, for example, in National Taiwan University Social Work Department, we have different specialties. Okay, right now, and the labor issues is one big thing right now. Especially in Taiwan, we focus not only for the local labor workers, laborers, but also focusing on the migrant workers as well.
Thank you very much, Dr. Yang. I'm glad you can hear me now. Finally.
Yes, yes. I don't know what happened. Magic,
yeah. Yeah, thank you. And ขอบพระคุณนะคะดร.หยางนะคะที่ตอบคำถามนะคะในช่วงนี้เนื่องจากเวลาของเรามีจำกัดแล้วก็จะต้องมีการเสวนาวิชาการต่อไปนะคะเราก็จะก็จะขอหยุดการถามคำถามสดในตอนนี้นะคะแต่ว่าคำถามของทุกท่านนะคะทางทีมงานจะรวบรวมแล้วก็นำส่งวิทยากรต่อไปค่ะนะคะในช่วงนี้นะคะช่วงแรกนี้ก็จะก่อนที่จะเริ่มการเสวนาวิชาการต่อไปช่วงนี้ก็จะขอขอบพระคุณนะคะอาจารย์เพชรด้วยนะคะที่อยู่บรรยายกับเรามาตลอดนะคะแล้วก็เดี๋ยวอาจารย์เพชรจะแปลเป็นภาษาอังกฤษอีกทีนะคะ
So thank you very much, everyone, for this morning's session. And a special thank you to our distinguished guests from Taiwan and from the UK for your experiences and insights and for taking all those questions for us related to the severe challenges posed, of course, by the pandemic to social policy and social work. Thank you very much. We would like you, Dr. Peshan, to just stay with us for a few more seconds as we take a picture with you to remember this special occasion.
เราจะมีการถ่ายภาพร่วมกันนะคะแล้วก็โดยจะมี Professor หยางอยู่เป็นแบ็กกราวด์ด้วยนะคะค่ะช่วงนี้จะเป็นการถ่ายภาพค่ะ
可能是网络的关系哈，现在没关系，现在在照相。那我们也可以跟他们照相吗？他们应该看画面，如果他们安排画面的话，就是摆好一个笑脸，结。好，拍完了。
Thank you so much, Professor Yang. I will send you the photos to use after.
Thank you very much.
Yeah.
Thank you so much, Professor Yang.
Thank you. This has been a wonderful seminar. Thank you.
Okay.
Keep in touch.
Keep in touch. Yeah. Bye bye. Have a good day. อาจารย์เพชรมาอาจารย์ขอนี่โอเคอาจารย์ปูมาอาจารย์ปูมา Thank you โอเคตอนนี้มีผู้เข้าประมาณเท่าไหร่Yeah.
ขอเรียนเชิญผู้เข้าร่วมสัมมนาทุกท่านนะคะเข้าในนะคะสลับไปที่ Account อีก Account หนึ่งของ Zoom นะคะขอเรียนเชิญทุกท่านเข้าไปอีก1 Account ของ Zoom ซึ่งจะสามารถรองรับผู้เข้าร่วมได้มากกว่านะคะแล้วก็ตามรายละเอียดดูได้จากที่ Facebook ของคณะสังคมสงเคราะห์ศาสตร์ค่ะ
So we will now move into the panel discussion session, and just to remind everybody that there is a new Zoom link that you can access from the Facebook of the faculty. So please do open that link to join us for this second session. Thank you very much.
และก่อนที่จะเข้าสู่การเสวนาในช่วงต่อไปนะคะและก่อนที่จะเข้าสู่ช่วงการเสวนาในช่วงต่อไปนะคะตอนนี้ก็จะขอบพระคุณอาจารย์เพรสอีเวนส์นะคะที่ได้ให้เกียรติร่วมดำเนินรายการในช่วงเช้านะคะแล้วก็ช่วงต่อไปเป็นช่วงภาษาไทยนะคะก็จะเป็นดิฉันดำเนินรายการเดี๋ยวช่วงนี้ก็ขอบพระคุณอาจารย์เพรสมากค่ะในช่วงนี้จะเป็นการเบรกนะคะประมาณ5 นาทีค่ะก่อนที่จะเข้าสู่การเสวนาวิชาการนะคะขอเรียนเชิญทุกท่านเข้าสู่ Account ใหม่ของ Zoom นะคะเพื่อเข้าสู่ช่วงต่อไปซึ่งจะเป็นการเสวนาวิชาการค่ะนะคะขอเรียนเชิญผู้เข้าร่วมสัมมนาทุกท่านเข้า Account ใหม่ของ Zoom นะคะสามารถดู ID และก็ Password ได้จากเว็บไซต์ Facebook ของคณะสังคมสงเคราะห์ศาสตร์ค่ะเรียนเชิญเข้าสู่ Account ใหม่นะคะค่ะตามลิงก์นี้นะคะที่โชว์หน้าจอตอนนี้นะคะหรือถ้าหน้าจอไม่ขึ้นเนี่ยท่านสามารถเข้าไปดูนะคะดูรายละเอียดเกี่ยวกับลิงก์และ ID ได้ที่ Facebook ของคณะสังคมสงเคราะห์ค่ะเรียนเชิญทุกท่านเข้าสู่Account ใหม่นะคะย้ายไป Account ใหม่ของ Zoom นะคะ
ท่านอาจารย์คะจะสะดวกมากเลยค่ะถ้าทางแอดมินช่วยใส่ ID ในช่องแชทให้นะคะขอบคุณนะคะ
ขอบคุณค่ะ
ค่ะขอบพระคุณค่ะเดี๋ยวทางเราใส่เรียบร้อยแล้วนะคะค่ะขอบพระคุณค่ะขอเรียนเชิญทุกท่านนะคะเข้าสู่Zoom ในห้องใหม่นะคะใน Account ใหม่นะคะซึ่งได้ส่งลิงก์นะคะทางช่างเทคนิคได้ส่งลิงก์ให้แล้วนะคะใน Account เก่านะคะขอเชิญทุกท่านนะคะ move ไป Account ใหม่นะคะ เรียนเชิญทุกท่านค่ะ